Good morning to you. It's Tamika Chambers here with another question to help you simplify, organize, understand, and apply the information that you have. So we have a question here, and remember, it's not so much about how they ask you, it's whether or not you know the content, whether or not you can critically think what's going on in the scenario, and picking out the most important information you need to make the best possible choice. All right, capillary glucose monitoring is being performed every 4 hours for a female client diagnosed with diabetic ketoacidosis. Insulin is administered using a scale of regular insulin according to glucose results. At 2 p.m., the client has a capillary glucose level of 250 milligrams per deciliter, for which he receives 8 units of regular insulin. Nurse vents should expect the doses. All right, so we have someone who has diabetic ketoacidosis, and they have a glucose result of 250, and they receive regular insulin per sliding scale. So they've already received 8 units. So what is this question really asking you? If you do a quick glance at the answers, it's basically asking you about the onset and peak of what? Regular insulin. All right, so would you expect, and I would encourage you definitely to put this in your name. I would expect, or Nurse Valerie, Victor, whatever your name is, because then it makes it personal. So would you expect the onset to be at 2 p.m. and its peak to be at 3 p.m., onset to be at 2:15 p.m. and its peak to be at 3 p.m., onset to be at 2:30 and its peak to be at 4 p.m., onset to be at 4 p.m. and its peak to be at 6 p.m. What would you expect? And so again, we want to look at, go ahead and pause, and write your answer, write your rationale, respond, go ahead and resume when you're ready. But okay, so we're going to resume. So we're looking at onset and peak of regular insulin. And remember, we have multiple different types. The common ones are your fast, your rapid, your fast, hemoglobin, the logs. We have our regular, we have our intermediate, NPH, and we have our long-lasting L's for Lantus and Levemir, long-lasting, right? And so we know the long-lastings don't have a peak. So we're not even thinking about that. We're thinking about regular insulin. Regular insulin has an onset of what? About a half hour, you guys, about a half hour to an hour. And it can peak anywhere from 1.5, 2 to 4 hours. And so the answer is going to be C. And as always, look at the rationales, because then you can find out more information about it. So option A, look, it says, inject 30 to 40 minutes before each meal, avoid cold injections, buttocks, thighs, arms. Remember, we want to try to keep it in pretty much the same area, but not the same site, if you will, because then we know we can cause problems with fatty skin disorder, or fatty skin. So again, you can do it in the same area because it increases absorption. So there it is, lipodystrophy. That's what I was trying to say. If you don't rotate the sites. All right, so hope this helps you. Remember, diabetes is definitely something you want to review. The insulins, what does it mean to have type 1, type 2? What does that diet or meal plan look like? And treatments for diabetic ketoacidosis and hyperglycemic hyperosmolar syndrome. So we want to look at that non-ketonic syndrome. All right, talk to you guys soon.